know that we need to take it seriously.
Head down in the rain, don't you think I want you to fight this? The language barrier.
Hey, I do. Hi, I'm Clara Wagner, and this is our Ask an Expert segment on our segment on depression. I'm joined by Lindsay Snyder, and I'll let you introduce yourself, maybe just speak a little bit about what your job is and your experience with depression.
Thank you. My name is Lindsay Snyder. I'm a licensed mental health counselor and a credentialed alcohol and substance abuse counselor, and I work for an agency called Delphi. I work right in high schools doing prevention counseling, so I work with kids who may be using substances, may have mental health concerns already, maybe just struggling through transitions at high school, developing some concerns, or just struggling with transitions. I have also had some experience with the outpatient field, working with people suffering from more clinical depression. I also am a trainer for the Mental Health First Aid youth program, and what that is we're training the community members and different people in the agency to be more aware to recognize signs of a mental health concern and how to intervene in a way that's going to be helpful to the situation.
Yeah, it's a whole diverse array of lots of different, working with depression, a whole lot of different capacities, so we're really happy to have you. Mm-hmm. I guess just starting off, could you give a general overview of what is depression? I think a lot of people have some form of an idea. Everybody at least, knows the word and has kind of a mental picture, but I think that there's a large spectrum in how people understand it.
There is. Depression is part of a category what we call mood disorders. So you have your depression, you have your bipolar. Sometimes people think that depression is anytime you're sad, but that's not it. There has a whole bunch of different criteria that go into someone actually being diagnosed with depression. And so you're talking about someone who is on average sad more times than they're not. It's not something that they can just wake up and shake off. It's something that's going to be taking over their life and really affecting their life in what we like to call the live, laugh, and love ways. So the ways we're living, the ways we're able to have fun, and the ways we're able to have our relationships.
Yeah. And obviously a question with no easy answer, but what causes it? What does it come from? How does it start?
Depression starts in all different kinds of ways. So some of it could be just a chemical imbalance. We each have different chemicals in our brain, and sometimes they work in great. They work all perfect together. Sometimes, just like someone who might have diabetes, we wouldn't question why they have it. If they have type 1 diabetes, it just is, and it can be the same if someone has a chemical imbalance. And in other cases, they might have been exposed to some trauma, and so that's a very common reaction to trauma is depression. They might be going through a grief, a loss of some kind, and that's not just a death. It could be a breakup, it could be a move, it could be anything that was important to them that was lost at that point. It could just be a transition. So there's a lot of different things that can cause depression.
Yeah. And once somebody has depression, what do you see in terms of the way they're acting, the things that they're doing? You mentioned the live, laugh, and love, but in terms of very tangible things, how is it, okay, my friend is exhibiting X, Y, and Z, so I think she might have depression?
One of the first things you might notice is somebody's sleep is interrupted, so they might be sleeping a lot, or they might have a really hard time sleeping. We think of symptoms of depression in extremes, so insomnia or hypersomnia. And we also look at weight gain or weight loss. Some people feel like they can't stop eating, they're always hungry. They might be emotionally eating. Some people have no appetite. Some people can't get out of bed. Some people isolate themselves and withdraw. So there's lots of different signs, but those are probably the most common ones you're going to see in teenagers. They might withdraw from a team that they're on or a club and just completely pull out of things that they used to love, but they're not replacing that. We wouldn't be concerned with someone having depression if they quit the soccer team and went over to the baseball team.
Right.
But if they quit the soccer team, quit singing and didn't replace it with anything else and just stopped hanging out with people,
Yeah.
that would be a sign to your friends that there might be something they should ask about.
Yeah. And once somebody is diagnosed or once they think they have depression, how is that usually treated, or what are some of the different ways that people try to treat it?
There's a lot of different ways. For kids in high school, the easiest way you can even get started is just by going to your school counselor. They usually have a pretty good knowledge and can be a good starting point. Also your pediatrician. So those are kind of two things that most teenagers are going to have. Beyond that, there's lots of different counselors. A lot of people go see outpatient counselors. That's like myself. And so that's not going anywhere for any length of time. You go there for an hour appointment once a week, once every other week, maybe even once a month. And you just have someone to talk to. So sometimes people get scared that they don't know what's going to happen if they ask for help. But in most cases, it's a short term, go have a conversation with someone. Maybe you'll see a psychiatrist. Maybe you'll meet with a psychologist. But most cases, you're just going to go have an appointment and then go back home at the end of the day.
Yeah. You mentioned a psychiatrist. I know medication is also a way that some people, or a part of some people's treatment of depression. So could you just speak a little bit about where that fits into the picture?
So depression is, like I said, caused by many different things. So if it's more of a chemical imbalance, then a lot of times the medication is going to be key. And there's different types of medications, so it's important to remember that if you're seeing a psychiatrist and they prescribe something, make sure that you're talking to them about any concerns and know that it's not a magic pill.
Right.
We have to try it just like any other medication, but psychiatric medications are really helpful in some cases. And in other cases, they can be a really great way to jumpstart things, because if you're feeling really depressed and you're having a hard time getting up and going to work, sometimes having a medication to kind of jumpstart that motivation while you're letting the talk therapy help out and learn the coping skills, it's a great balance.
Right, using as another tool in the toolbox.
Exactly. And the same thing with alternative therapies like yoga, more holistic thinking, meditation.
When we talk about depression, both in terms of the youth population and the population at large, how big of a problem is it? Or how widespread is it?
So it's a little hard to quantify just because we can only base it on what's reported and what's diagnosed. But about 14% of teenagers have been diagnosed with depression. And so the thing we need to keep in mind with that is, again, those are the ones who have come forward, who have asked for help and who have seen a doctor to be diagnosed. And we see that that usually happens more with females. We see a lot more females coming forward than males.
And I've read some articles and seen some information that say that those rates are increasing. So, you know, does that correspond with what you know and what you've heard? And then also, if so, do you think that's because more people are coming forward, or because more people are actually having depression, or there's just no way to tell?
I think we're doing a really good job of kind of attacking the stigma that's been associated with mental health. And so people are feeling more comfortable asking for help and realizing that you can get over depression and you can get over anxiety or any other mental health concerns. So it's important to come forward, get some help so that we can get you back to the you that you're happy being. And so I think the numbers that we're seeing increase have come along with that reduction in stigma, the increase in pushing for the treatments and encouraging people to get help and talk. We had the mental health parity law that was passed, so we have a lot of things legal-wise and insurance-wise that have been put in place to help people get the care that they need.
Right. And so I don't exactly know how to phrase this question, but are there different kinds of depression? Because obviously there's different degrees of how bad it is, or severe it is, for lack of a better word. But are there actually kind of differentiated kinds?
Yes. If you want to get really technical, there's lots of different diagnoses. But basically the way it works is it depends on the severity, so how intense it is and how long it's lasting. There's different diagnoses associated with that. There's also different diagnoses for if it's an adjustment like someone moved and they're depressed because
Right.
they moved to a new state and they're just adjusting, or if it's grief, we call that bereavement.
Yeah.
So it's still depression, but it's got a different name.
Yeah.
So.
And are there any ways to prevent depression? Obviously, it depends on what caused the depression, yada yada, but in general.
The biggest thing you want to think about is there's risk factors and then there's protective factors. So there's things that are going to happen in our life that are going to make us more at risk for developing depression or another mental health concern. There's other things that are going to help protect us from those and help us build up our resiliency. Those are things like having an adult we trust, and it can be a family member, it can be a neighbor, it could be a teacher, it could be anyone, but it's really important to have an adult, not just your peers, but someone that's older, more connected, more aware, that you can connect with. It's also really important to feel like you belong. So finding that place where you feel like you fit in, whether it is sports, music, arts, into a studio club, whatever it is that fits and makes you feel like you're part of something, that's really important. Knowing general mindfulness, so being able to take care of yourself. I tell a lot of people I work with, you should be taking at least an hour a day for yourself. We're so rushed that if you give yourself 15 minutes, I'm happy. But we need to give ourselves that time every day to decompress and look at what's gone on today. Has it been a bad day, a good day? What are some of the good things? Remind yourself of the good, the bad. And I think it's really important now that we recognize our emotions and we work on learning to identify our emotions.
Absolutely.
And being able to identify that is really important. For teenagers, the first time they're experiencing depression, most of them don't know what it is they're feeling. They've never felt this before. No one's ever defined it before. So it's important for us to be able to communicate what is going on, what we're thinking, what we're feeling.
Yeah. And I think a lot of the time, until you try it, it's really easy to say like, oh, of course I know when I've had a bad day, or of course I know, oh, this is sadness, this is anger, this isn't. But I think that so few people actually stop and do those things. I mean, I think it's one of those things where a lot of people think, oh, I know when I've had a bad day, or I know when I'm feeling sad, I know when I'm feeling angry, but so it's not a thing that's quite as easy as we think it is. So sometimes it's just we're engaging in these behaviors that maybe aren't good for us, and we aren't even noticing that that's stemming from a way that we're feeling because we haven't gotten into that practice of stopping and figuring out like, oh, okay, when I feel anxious, you know, my chest gets tight and I want to go play video games instead of doing my homework. And then once you can figure that out, it makes a big difference.
That's a big thing to talk about too with guys especially, because one of the reasons we think we see more females being diagnosed with depression is it's more socially appropriate for a girl to admit that they're having crying spells and that they can't stop crying. With guys, a lot of times we see teenage guys present with depression symptoms that are anger. They're punching, they're having uncontrolled anger outbursts, because that's more socially appropriate for them than to be crying in the bathroom. So they express their emotion in that way.
What about the other ways that depression kind of leaks out into unhealthy coping mechanisms or decisions and behaviors?
We see a lot of different unhealthy choices. Sometimes we see what we call self-harming or self-injuring behaviors, and that can be cutting, it could be burning. There's a number of different things that people can do, and it can be hard to understand, but in some ways they can be healthy. Because if someone is suffering from severe depression and is having suicidal ideation and a lot of thoughts about wanting to kill themselves, sometimes that self-injuring is enough of a release that those thoughts go away for the time. So it's almost like a safeguard. So a lot of times people get scared when they see cuts or burns, and it's really important that we get people who are self-injuring the professional help they need, but it's also important to know that that may be what's keeping them alive at that moment.
Absolutely.
We also see a lot of use of drugs and alcohol. There's a really great speaker named Kevin Hines. You can look him up on YouTube. He speaks a lot about
H-Y-N or H-I-N?
H-I-N-E-S. and he speaks a lot about his experience with bipolar depression. And he does a great job of kind of talking about how when he was a teenager, his friends were drinking and using drugs because it was what was fun to do on the weekend. He was drinking and using drugs too, but because of his symptoms of mental health.
Right.
And so nobody was being flagged because he was just doing what was considered and dismissed as typical teenage behavior. But his reasons for doing it was completely different.
Yeah.
So that's another thing, that if your friends are drinking and using drugs a lot, that's a good time to ask them a question or to reach out to an adult, because you never know why they're doing it and what's going on.
Right. How about anxiety?
Anxiety has definitely been increasing in our young people. We're seeing a lot of high schoolers dealing with anxiety, a lot of high schoolers dealing with different medications for anxiety, panic attacks. And some of the reports are linking that to increased social media use. And this is more from what I've read, my opinion, but it's kind of the idea that when people were growing up, even when I was in high school, we had AOL, but we didn't have much else. So you'd go to school, and when you were in class, you were alone. You were with the teacher and your friends, and the worst someone could do to you was pass you a note. Now I'm seeing kids who are coming into me, and they're already upset because of something's going on, and their phone is blowing up with text messages and notifications of what people are putting online and posting about them. And there's pictures, and everybody's taking pictures left and right. And so you don't have that space where you can go and be comfortable and feel at peace, because someone's always watching, and someone's always documenting what you're doing.
Right.
And there's so much more pressure.
Yeah. What are some things that you think could change or be added to or emphasized or whatever in schools or in youth lives in general that would kind of just make for better mental health?
I think that yoga is actually a very helpful practice, and a lot of schools have realized that and are starting to implement that. Stress management, it's really important to know that stress can be good, it can be healthy, but we need to learn how to manage the unhealthy stress.
Right.
And like I mentioned before, we need to figure out what our emotions are. We need to be able to identify when we're feeling anxious, when we're feeling embarrassed, to be able to differentiate that a little bit. We also, it's important to understand that it's okay to ask for help, and that the majority of people, 22% of adolescents, struggle with some form of diagnosed mental health concern during adolescence. So that's a fifth.
Right.
You're not alone, and you shouldn't be afraid to ask for help, because someone's going to be there, and hopefully the first person is ready to listen. But if they're not, we hope that you'll ask a second person.
Right.
But that can be really hard to do. And that's where the mental health first aid comes in, is we're trying to get family members, community members aware, so that if they're the person someone comes to, they're ready to answer that and to link somebody up with the care that they need.
Yeah. And so if, for that person that is the first go-to, the, hey, listen, I don't know what's going on with me, but I'm feeling really bad and I don't know what to do. Or that person who hasn't been approached but is observing some behaviors and is becoming concerned, what should they do?
That really depends how comfortable they are. They could get a couple hotlines if they aren't really comfortable saying much. There's the National Suicide Hotline. There is some different treatment agencies that have all different websites for adolescents. A lot of people go to Westfall locally and Unity, and you could look those places up and just pass them a phone number. You could, if you're in school, again, it's a lot easier. You can go down to the counselor's office and just say, hey, I'm worried about this person, this is why. And I can speak from experience as a school counselor. We don't rat out the person who told us. We want to check out every concern. And we want to make sure that we're following things up, but we're not going to look at you, the person coming forward, as someone who's causing a problem. There's also, if it's a more severe instance, so if someone calls you and they're saying that they want to kill themselves, absolutely that's a 911 call.
Yep.
Unfortunately, I think teenagers want to help, and sometimes I hear about teenagers who say, well, but I don't want my parents to know. I don't want anyone to know I'm thinking about this. I would rather have somebody be mad at me because I told, but have them be alive the next day
Yeah.
than to make that mistake. So
Right.
it's always better to err on the side of call 911.
Yeah.
If you're just worried about someone, there's another great resource we have in this area. It's Mobile Crisis Unit. So that's for the less urgent concerns.
Yeah.
But that's through U of R, and that's 275-5151. You just call up and say, this is what's going on, this is why I'm concerned about the person, and they'll come out and check them out.
Yeah. Huh,
So-
I didn't know about that. And then just another thing that I've heard of is kind of in that similar vein, but I'm not sure how it's differentiated. I'm not 100% sure what it's called, but it's something like mental health arrest. So it's like the hospital comes and takes you, and like, you know,
Yep.
you don't have a choice in going, but it's not calling 911.
Well,
I don't think.
if you call 911, you're going to get a police officer usually and an ambulance. And what you would do is you call 911 and say, I have my friend, my brother, my sister, they're talking about killing themselves. And they'd be looking at doing a mental hygiene arrest is what you're talking about.
Yeah.
Mental hygiene arrests are done, though, when the person doesn't want to go voluntarily.
Okay. Got
So
it.
that's the difference. If they show up and say, you know, I think we should go to the hospital and have someone check you out, and they're willing to go, they're just going to give you a ride. That's
Yeah.
not considered a mental hygiene arrest.
Okay. Yeah, I was just wondering what the difference was. What misunderstandings, misconstructions do you often see about depression as well as some other mental illness?
I think the biggest one I hear with teenagers is they're just being a teenager, or they're just moody. Especially when people are talking about suicidal thoughts, I hear all the time, they just want attention. And that's one of the biggest things I think we need to remember is that's not a way to get attention. So if someone's saying that, we know that we need to take it seriously, because people don't usually say it for attention. They say it because they're
Right.
thinking it. There's lots of other things we do for attention. So
Right.
if someone's coming to you and saying that they're thinking about killing themselves, that's a time to get some professional help, not a time to think about, oh, they just want attention, or they're just being a teenager, they're being dramatic. It's
Yeah.
always better to get it checked out.
Right. And also, just in my own opinion, for me, the doing something to do attention, I think, has been connected with it has such a negative connotation where, like, if that's your motivation for doing something, then, like, you're not a good person. But I think that if you think about it, if you're doing something to get attention, that means you need attention. So I think that stems back to the not belonging or not feeling okay. So I think that, yeah, that it really can't be used as a way to wave something off.
The other thing, just kind of going back to the suicide, if you are around somebody who talks about suicide a lot, and then all of a sudden they seem very at peace and they don't talk about it,
Yeah.
you definitely need to get help,
Yeah.
because that very often is what happens right before someone attempts to kill themselves.
Yeah. And so, just as a last question, do you kind of have a final message for anybody that might be watching, whether they be somebody who's struggling with this, somebody who knows nothing about it, whatever? Any thoughts?
My biggest thing I would say to any teenager going through any sort of emotional uncertainty is just ask someone for help. Be willing to just go have a conversation with that counselor, that teacher you trust. Tell somebody how you're feeling, and maybe it's nothing. Maybe it's just you're having a rough time, but maybe it's something more. And so just talk to somebody.
Yeah. Yeah. Thank you so much for being here.
Thank you.
And in general for providing support to all the people that need it. We definitely appreciate you helping to get some information out and helping destigmatize it, and some of those resources you threw out, I'm excited to look up. So thank you so much. We really appreciate it.
Thank you for having me.
And this has been Clara Wagner with Talkback for Teens. This was our Ask an Expert segment for our episode on depression.
I believe if you wanted to leave, you would seek relief. Sell your house to the banker.
Yeah, there's no safe place.
Sell your
No
jet
safe place.
skis and papers too. Get the hell out of Madison. All the dirt you wander through.
These are what are typical things teenagers might go through.
Grab your dope and your shell-toe shoes. Go and fax your lawyer. All the dirt you wander through. All the dirt you wander through. All of you floats down Flatbush Avenue. All run through. All the weight of all you knew. Sell your house to the bankers. Sell your tchotchkes and papers too. Get the hell out of Kensington. All the dirt you wander through. Go and call your accountant. Grab your dope and your shell-toe shoes. Get and call your lawyer. All the dirt you wander through. All the dirt you wander through. Nobody likes you. Nobody you like likes you now.
Feelings are harder than people think they are.